My name is Jamie Cooper, and I'm a professor in the Department of Foods and Nutrition here at the University of Georgia. I'm also the director of the UGA Obesity Initiative. We started research with cottonseed oil back in probably 2013, maybe 2014, and we were interested in the health benefits of cottonseed oil. With some of the collaborators that I've worked with, they had found some interesting things in terms of the metabolism of cottonseed oil and how that could affect health potentially in humans. And so we started doing research in that. And our first study was in young, healthy adults. We looked at the effect of a cottonseed oil enriched diet compared to an olive oil enriched diet. It was just a 1-week diet, and we fed them all of their food. We cooked it with either the cottonseed oil or olive oil, and we looked at health outcomes. And we found that there were some improvements in metabolism with the cottonseed oil enriched diet, some improvements in appetite markers or appetite regulation, and the biggest improvements we saw were with cholesterol profiles. So even though they were healthy individuals, we saw improvements in total cholesterol, LDL, that bad cholesterol, and we even saw increases in HDL, or the good cholesterol. So that prompted a second study, and that's the one we've been working on for the last couple of years. Of course, we always want to improve health in individuals, but being able to improve cholesterol profiles in already healthy young adults is maybe a little bit less meaningful than being able to improve cholesterol in someone that has high cholesterol. So for the study we've been working on for the past couple of years, we wanted to compare a cottonseed oil to an olive oil enriched diet in aging adults, so over 50 years of age, that had high cholesterol. So they had maybe tried diet and exercise in the past, hadn't met with a lot of success for that, and so we've been enrolling people into that study. It's an 8-week intervention study, and we provide about 3/4 of the food to them, and the foods are cooked with either the cottonseed oil or the olive oil, depending on which treatment group they're assigned to. So we're finishing up that study despite some setbacks with COVID and having to stop testing for a little bit of time. We're hoping to finish participant testing this summer. And our outcomes are similar to the previous study. So we're looking at metabolism, we're looking at appetite, and our primary outcome is those cholesterol profiles and lipid metabolism. So we don't have the final data yet, but our preliminary data looks very promising. We are seeing improvements in cholesterol profiles and lipid metabolism in those adults that are getting the cottonseed oil enriched diet. It's interesting because we've been working with this oil for a number of years, and I think when we talk to our participants, it's common for them to say, oh, I cook with olive oil. I know that olive oil is good for me. I've heard it's healthy. And they're much less familiar with cottonseed oil. And I think part of what we're trying to accomplish is to show the health benefits of cottonseed oil. People consume cottonseed oil in their diets. They maybe just don't know it or don't pay as much attention to it. And so our job is kind of twofold. We're trying to do this health-related research to find out, if there's improvements in health markers with consuming cottonseed oil. But then we want to work with our industry partners. So we've been thankfully funded by Cotton Incorporated and National Cottonseed Products Association for a number of years. And part of our goal is to be able to work with them to get the message out. So this is our clinical lab space where we bring our participants for the intervention studies that I've been talking about. So we've got a couple of different rooms. Our phlebotomy room, we draw blood for just about every study that we do, and so that's how we measure our cholesterol profiles and our appetite hormones as well. In here is our metabolic carts. So this is where we actually measure metabolism on our participants. So there's a canopy hood, and they will lie down on the bed with the canopy hood over them, and we collect respiratory gases. So oxygen consumption and carbon dioxide production. And from that, we're able to determine how many calories they're burning, how much fat they're burning, how much carbohydrate they're burning. So we get very good metabolism measurements, And then we also have a bod pod over here, and that is for measuring body composition, so we can determine percent body fat. One of the things we want to be careful of with our studies is to make sure that people are maintaining their body weight, so we don't want people gaining weight or losing weight over the course of these intervention studies. So we're able to monitor that carefully with things like the bod pod.
Yeah, my name is Chad Paton. I am an associate professor, and I have a joint appointment in both the College of Ag and Family and Consumer Sciences. College of Ag position is in the Department of Food Science and Technology, and in fact it's in Foods and Nutrition. The work that I do is primarily biochemical nutrition, so what we're trying to do with the Cottonseed oil project is really identify what are the specific components of cottonseed oil that lead to its healthful benefits. What we've been doing in the past is looking at both cell and animal models to try to dissect what are the specific components within cottonseed oil. What we found over the last few years is a very specific, unique lipid containing cottonseed oil in very low quantities, but very potent in terms of improving metabolic health and metabolic regulation. What we're trying to do now with the projects that we're utilizing is, once we have identified what that specific lipid component is in oil, it's a very low percentage. It's about 0.3% of the total oil content of cottonseed. What we're trying to do now is refine cottonseed oil so we can condense it down and go from 0.3% up to maybe 3 to 5% of the total oil content. If we can do that, we would look at that as more like a value-added processing technique, where we could take an existing product that the growers are producing and increase the value and increase the benefit both to the grower and to the consumer. If we can identify the healthful component of that, it may increase the demand from the consumers to want to consume cottonseed oil to either reduce their cholesterol content, reduce fat content in their livers, and that sort of thing.